What follows is a public comment made to the Corporation Committee on September 10th, Agenda Item 9, the powers of state and local health officials. This comment was made on behalf of Wyoming concerned citizens. For this comment, we'll look at what COVID-19 is. We will present evidence that COVID-19 is not an emergency anymore. We know that now. We'll make the argument that the risk of a disease has to be weighed against the burden of orders, and that can only be accomplished today by dropping all enforceable health orders. An approved Working Bill Public Health Order 2 to be introduced and voted on by the legislature. Finally, we'll look at the role of health officers, citizens, and legislators that all have to play in relation to that proposed piece of legislation. COVID-19 is a viral infectious respiratory illness like the flu is. By that we mean the flu is also a viral infectious respiratory illness. The flu is caused by the influenza virus, and COVID-19 is caused by the coronavirus. Pneumonia can be caused by either a bacterial infection or viral infection, usually a bacterial one, but the flu can become a pneumonia. The CDC refers to this group of disease as PIC for pneumonia, influenza, and COVID. COVID would be called a cold, but never the flu. And just like with the flu, a cold can become pneumonia. This is an extract from the CDC webpage about the common cold. It says rhinoviruses are the common virus that cause cold, but other viruses can cause colds too, including human coronaviruses, which is what COVID is, as we just stated. If you click on that human coronavirus link shown here, you'll get to the COVID-19 page. The data is in. The fatality rate for COVID-19 is far lower than first expected. We know now COVID-19 is not alarming. COVID-19 is no longer an emergency. So why do we still have any health order at all? If we look at all the causes of death, not just COVID-19, we can clearly see it's not concerning. Here are the causes and the numbers of deaths for the state of Wyoming in 2015. The total number of deaths was 4,778, on average of 13 per day or 92 per week. Those numbers are to be expected every year. Deaths are part of life. So far, we had only 42 COVID-19 deaths for whole 5.5 month periods. So that's with a span over a span of 24 weeks. That's an average of 0.25 deaths per day, so 1 every 4 days, or 1.7 deaths per week, less than 2 per week. Compared to the usual numbers, clearly COVID-19 death numbers are not concerning. COVID-19 death has created no excess death, no burden. How is that compared to the US number? So far we had only 188,513 COVID deaths in the US. That's an average of 1,122 deaths per day, or 7,855 per week. Again, compared to the usual number, clearly COVID-19 death numbers are not concerning. COVID-19 has created no excess death. Looking at causes of death, COVID-19 would be under influenza and pneumonia category. Like we said earlier, the CDC today refers to this group of illnesses as PIC. Every year we experience influenza and pneumonia or PIC death, and 2015 was no different. We had 99, which represented 2.1% of all Wyoming deaths in 2015. This was only the 10th leading cause of death in Wyoming, or 8th leading cause of death in the US as a whole. What's the leading cause of death for Wyoming? heart disease, just like for the US as a whole. Coming in second actually is all other causes, which include people passing away from natural causes, whose lives are something to celebrate. In terms of disease, malignant neoplasma or cancer will be the second deadliest one. Next, or third leading cause of death in Wyoming is accident. It is the fourth leading cause of death for the US. What does this mean? Wyomingites know about risk. They make decisions every day, weighing the cost of those risks against its benefits. A bad cold might represent a substantial risk for desk workers and public transportation commuters in New York, but a bad cold represents a minimal risk to Wyoming workers compared to other risks. It makes no sense whatsoever to call COVID-19 an emergency. Accidents represent 8.4% of all Wyoming deaths compared to 5.4% for the US as a whole. Suicides or self-harm represent 3.3% of Wyoming deaths in 2015 compared to 1.6% in the US. In short, there are many more deadlier diseases than COVID-19 or riskier situation than being within 6 feet of a coworker. This graph is from the CDC Weekly Updates page and was consulted on September 7th. It shows COVID-19 deaths from week ending February 1st through week ending August 29th. The upper red line on this graph is for the age group 85 years and over, and the lower light blue line is for age group 0 to 24 years of age. In percentage terms, the 0 to 24 years of age group has experienced less than 0.5% of all COVID-19 deaths, and the 0 to 24 years of age group experienced less than 30% of all COVID-19 deaths. That's just COVID-19 deaths, which represent only a fraction of all deaths. This page makes reference to 0 to 18 years of age group instead of the 0 to 24 one, and state that children and adolescents under 18 years of age account for less than 0.1% of all COVID-19 related deaths. This page also states that so far COVID-19 related deaths of children are less than in each of the last 5 flu seasons. COVID-19 is a cold, not a flu, but COVID-19 death is compared to flu death a lot, and it is here. So why do we need to amend Wyoming Statute 35-1-240? It's not just because we have evidence today that COVID-19 fatality rate is far lower than first expected, that it represents a far lower risk than other diseases and situations, that it is not alarming and shouldn't be referred to as an emergency anymore. The reason we want to amend Wyoming Statute 35-1-240 is whatever situation we find ourselves in tomorrow, if our goal is to maximize welfare to society as a whole, do what's right for our community, make people better off, then we do need to bring in all parties into the decision-making process. Epidemiologists are expert in the incidence, distribution, and possible control of disease. But parents, business professionals, and certainly small business owners are experts in weighing risk, cost, and benefit when making decisions that are best for their families and businesses. Many health professionals do also understand that it takes a holistic approach to best care for the individuals in their charge. This is the reason we need to amend Wyoming Statute 35-1-240. We just cannot make good decisions in a vacuum. And that's what happened this time, and still is ongoing. We need to stop this, and we can't let this happen next time. Businesses and non-profit establishments closed. Some still are, or reopen only at limited capacity. K-12 closed. They reopen, some in person, others online. Gathering at lunches or at sporting events are still restricted. Public school, even in Wyoming, is a mess. Depression and suicide numbers have increased. People got hurt more than by the restriction than COVID-19 itself. People got hurt more by the restrictions than COVID-19 itself. You know that. We all know that. The cure has been and still is worse than the disease. Dr. Jolene Falkenberg says it best. Doctors, educators, food service, chain suppliers, employees, business leaders, children that bring us joy, and elders that bring us knowledge are all critical and should all be allowed at the discussion table to balance the risk of COVID as a disease and as a burden to our society. It is clear that to make decisions that best serve society as a whole, as in serving each group within society, as best as possible, we need to balance the risk of COVID as a disease against the burden of health orders. And to do that, we need to bring all expertise to the table. This clearly means the powers of our health officers, as currently written in our laws, have to be amended. Even the CDC finally gets around to acknowledge the harms attributed to closed schools on the social, emotional, and behavioral health, economic well-being, and academic achievement of children, in both the short and the long term. They acknowledge that those harms are well known and significant. The CDC also points out the lack of in-person educational options disproportionately harms low-income and minority children and those living with disabilities. So why is it important to bring in all expertise in the decision-making process? Because we cannot maximize welfare to society as a whole without doing so. Because we cannot possibly know what the different groups and individuals' needs are, or attempt to, without bringing in different expertise or different stakeholders at the table. The scientific knowledge, theoretical or technical expertise of one person or one profession, no matter how smart or a great scientist that person is, or the persons within that profession are, is not enough. They are not almighty. They can't possibly know the ever-changing circumstances, constraints, needs, and preferences of all individuals in our society. Every individual ultimately has some unique knowledge that all others do not have. And when trying to make decisions for the good of society as a whole, it's going to be hard to include all this unique knowledge. We won't get there, but we certainly will get closer to a decision that will be more welfare enhancing for all if we bring in all expertise into the decision making process via our elected officials. And wouldn't that be called the democratic process at work? Now, how can we best serve society as a whole in those types of circumstances like COVID-19 put us in? Maybe adopting the following guiding principle can help. Not knowing in which group, the high risk or the low risk one, we, our family and our friends will belong to tomorrow, what actions can we agree on today? Another way to put this might be to say any action or measure to make one group better off, group A, the higher risk one for example, cannot be undertaken unless it makes another group, B, the lowest one, no worse off, and vice versa. Anything we do to make group B better off has to leave group A no worse off. If we had followed this principle, we would have never shut down our economy to the extent we did, and we would not find ourselves in the situation we are in now. If we were following this principle, we would let children gather without restrictions. High-risk kids would take online courses taught by high-risk teachers, while low-risk kids and teachers would gather in person, not the other way around, which is what we have now. Measures to decrease the spread of the disease will still be taken in hospitals and assisted living facilities, but restricted visit by close family and friends would be allowed. As a community and within our governmental organizations, we must be more attentive to the different groups and individuals' needs and take measures or issue guidelines that are going to benefit at least some groups and individuals without hurting others. And that is why we need to amend Wyoming Statute 35-1-240. Here's a proposed amendment to the Wyoming Statute. The first link on this slide is where one can find the Wyoming Statute 35-1-240, which is shown below. The second link is where you find the draft legislation Public Health Order 2, which was introduced to the Corporation Committee on June 10th, and which would curtail the powers of our health officers by restricting the length of time health officers can exercise emergency powers without supermajority of the legislators. The amendment looks pretty much as shown here, but not quite. So please go to the second link to see exactly what that draft legislation proposes. Our current laws give the powers to our health officers to shut down our schools and forbid gathering ad infinitum, forever. We need to restrict the length of time our health officers can exercise their emergency powers without supermajority of the legislature, so all parties' concerns can be heard. So such emergency decisions are not made in a vacuum like they were this time. So the cure doesn't get worse than the disease. Our health officer will still have emergency powers, of course, because some situation in the future might call for it. We, citizens, via our legislators, are not telling health officers and doctors how to do their job. We just want to make sure the risk of a disease is weighed against the burden of health orders to our communities. So what are citizens, senators, and representatives and doctors' roles? We heard it last time from Ms. Bush from the Wyoming Medical Society on June 10th, who said doctors she represented did not support this proposed amendment or legislation because doctors didn't need commoners like me, nor legislators, to tell doctors how to do their job. Again, this is not what this amendment is about, not at all. In wanting Working Bill Public Health Orders 2 to be approved for introduction and voted on, our goal, we concerned Wyoming citizens, is not to question medical doctors and epidemiologists' expertise and skills in finding and implementing treatment to COVID-19 or other disease we may encounter in the future. It's not our goal to question our state and county health officers' expertise and skill in issuing guidelines and monitoring the situation. Our goal is to communicate to our elected senators and representatives that by concentrating only on COVID-19 or only on one specific disease, we not only don't necessarily decrease the level of all illnesses and the level of all death, but we create miserable living conditions for many, hurting their financial, physical, and emotional health. Because we need to balance the risk of a disease, COVID-19 or another, against the burdens of health orders to our communities, we need to amend Wyoming Statute 35-1-240 and approve Working Bill Public Health Order 2 to be introduced and voted on. Thank you for listening to the public comment just made on behalf of Wyoming concerned citizens. We are not the ones who worked on draft legislation Public Health Order 2. We're thankful for those who did, and we support it. We can be contacted at wyomcitizen@mail.com, and you can also find us on YouTube via our Wyoming Citizen channel.